serious face.
In analyzing the role of the advanced practice nurse, we interviewed Sherry Mongold, who works at Harrisonburg OBGYN, and also Vicki Carruthers, who works at the JMU Health Center.
Sherry Mongold is a family nurse practitioner that focuses on women's health. She described that she became an advanced practice nurse to be able to work in an environment that excluded shift work was very appealing, and also she wanted to practice more autonomously.
And Vicki works at the JMU Health Center. She entered nursing at an older age. She toggled back and forth between what she wanted to do, and she thought about midwifery, but she opted to go into family practice instead. She was motivated by the liability issues involved with midwifery. She didn't want to take on-call hours, so family practice seemed to be the perfect fit for her. So Vicki Carruthers got her BSN at Hope College in Michigan. And then she came here and worked night shift at Rockingham Memorial Hospital. After her probationary period, she decided it wasn't for her. She wanted to become an FNP instead, and so she made it on her list of goals, followed her dreams, and went ahead and went to UVA to get her FNP.
Sherry Mongold received her BSN at Eastern Mennonite University. She worked as an L&D nurse for 5 years and then decided she wanted to advance her career. She ended up getting her MSN and became an FNP from Old Dominion University. Both Carruthers and Mongold are accredited through the American Nurses Credentialing Center, or ANCC.
So Vicki has been a nurse for 12 years, and an advanced practice nurse for 12 years. Sherry Mongold has been one for 20 years. When you talk about advocacy and collaborative goals, Vicki Carruthers described her close working relationship with all of the practitioners and other people that work at the office. There's 3 NPs, 1 PA, 1 pharmacist, 4 physicians. They consult with each other. They discuss treatments. They talk about medications and follow-up. Weekly, they have discussions of new cases, new protocols, new medications, new pharmacy administration, and also clinical updates.
Sherry Mongold provides primary care for women's health. She facilitates screenings appropriate for age and also provides disease management. Sherry Mongold is from a private practice, and she states there is a practice agreement and it's kept in the manager's office. But she's worked there for so long, she's been practicing at the practice for 20 years, and she said it hasn't been reviewed anytime recently. She said there is a need to set up distinct set protocols for the practice.
Conversely, Vicki told us that she provided a specific NP collaborative agreement contract. In the contract, outlined were the details of what the NP is authorized to do, what's required of the NP, the roles of collaboration, consultation, and documentation. So, as I talked about all the people that are involved in the clinic at Vicki's or at the JMU Health Center, she talked about the collaborative work of their interdisciplinary team. She said they work with the wellness staff of the University Health Center for students with issues concerning drug and alcohol problems, LGBTQ and sexual issues, assault and partner violence. She elaborates on the referral system that they use. When students need other services, they go to the Office of Disability Services, the Counseling Center, the Learning Center, the Dean of Students Office. When they have labs that need to be done off campus, they send them over to LabCorp and any community health needs that the students would have.
The office that Sherry Mongold works at has an interdisciplinary team that consists of 4 medical doctors, 1 doctor of osteopathy, 2 nurse practitioners, 1 women's health nurse practitioner, a certified midwife, 3 ultrasound sonographers, and together all these disciplines are able to provide a solid team.
Vicki is a member of the American Nurses Association, a charter member of the Pi Mu chapter of Sigma Theta Tau Nursing Honor Society, a member of the American Nurse Practitioners in the Virginia Council of Nurse Practitioners Shenandoah region. She believes all of these organizations are important to build and maintain relationships with other professionals in this field of work. She likes to stay abreast on policies and practice news through these organizations. She's also been involved in signing petitions related to nursing policies.
Sherry Mongold relays that currently the only organization she is a part of and can keep up with is Kids Carpool. Sherry Mongold and Vicki Carruthers come from different walks of life. Sherry's kids are middle school age to high school age, and Vicki Carruthers are young adults. Therefore, walks of life can determine the amount of organization involvement. Sherry Mongold relays the information that her office pays for the malpractice insurance. Therefore, she's unaware of what the cost is.
Vicki Carruthers disclosed that the JMU Health Center provides malpractice insurance for the providers, and neither one of the nurse practitioners have sought out any additional coverage.
Sherry Mungold works in a private practice where the nurse practitioners are paid an hourly rate, approximately $40 to $55 an hour. They are not productivity based. She also states that the providers are compensated for continuing education, where they also provide a set number of days off for education and also sick and vacation times based on the hours spent in the office. Sherry Mungold works 4 days a week and is considered a full-time employee.
Vicki is a state employee. She receives an annual salary. She has an array of other benefits that are included, such as health insurance, retirement benefits with a cash match plan, Social Security, annual leave. She gets vacation-based length of employment with the state of Virginia and long and short-term disability and group life insurance.
Same as Sherry Mungold's office, the JMU Health Center does not provide compensation based off productivity. Sherry Mungold says Harrisonburg OBGYN uses a charting system called Greenway. This enables the doctors to look at the charts at home and at the office, also allowing the front-end staff to make appointments and do the appropriate billing charges. The whole healthcare team determines the ICD-10 codes along with visit level codes.
Vicki Carruthers talks about the JMU Health Center differing from primary and private practice because they don't accept insurance. They provide free care to students. They do use an EMR system for charting, coding, and billing. The providers at the health center use ICD-9 codes and visit level codes, and they also do accept cash, credit card, JMU Flex card, or checks to cover the cost of any labs or x-rays.
Sherry Mungold points out that negotiation is a key factor when a nurse practitioner is beginning to establish their contract.
Vicki Carruthers said it was really important for her to come working in a facility that already had established FNPs or PAs. Going into that practice had established roles that you could outline in a contract. She points out that it was important to negotiate adequate time with each appointment for the first several months. That enabled a new practitioner to become familiar with the facility, with the charting, and to be able to spend a little more time with the patients. She also says that as she's an employee of the state, she has a director that approves her seminars, that approves her conferences. That can be different in private practice. It's important to, she said it was important to include all travel expenses, the cost of the seminar, food, and housing. She said, Vicki Carruthers emphasizes to be clear in your contract negotiation about responsibilities, including call time, how often, what that would entail, any mandatory conferences or seminars. What are the responsibilities of the NP outside of a normal workday? Just things to think about.
Sherry Mungold stated that it is important to negotiate. The first offer that they give you, it does not have to be the last. Both nurse practitioners believe it is important to make oneself more marketable in learning as many new skills and procedures, but also negotiation compensation for education.
Boom.
In conclusion, in choosing a nurse practitioner career path, consider the following: personal areas of interest, employment outlook, salary, and career flexibility. During the interviewing process, it was evident that both Sherry Mungold and Vicki Carruthers had taken these factors into consideration when choosing a path to follow their practice. Through their thoroughness, clarity, and transparency, we were able to gain a broader perspective of how an advanced practice nurse can vary, the roles can vary, in addition to the benefit of seeking a position that works in one's phase of life, like no night shift.
Thanks. In analyzing the role of the advanced practice nurse, we interviewed In analyzing the role of the advanced practice nurse, we interviewed Sherry Mungold, who works at the Harrisonburg OBGYN.